Imagine this, your mom takes a fall, she's rushed to the ER, but you breathe a sigh of relief because the doctor said she's stable. She's going to need to stay in the hospital for a couple of days, but you already start thinking about healing, about getting her home safely. But before they will do anything else for her, they slide a clipboard across the table and ask you to sign it. And what's on that paper is an understanding that you will pay $3,500 per day starting right now. There's no real explanation for it, just urgency and pressure in a moment when you're most vulnerable. And in that fog of fear, you most likely will sign. You're not even sure what it really means because she does have insurance, and that's where the trap begins. And speaking of this, welcome to a very interesting episode. Lean in, grab a cup of your favorite beverage, and let's just take a deeper look into this because I ran across that video recently. And this is a nurse who works inside the system, and she felt like she could just no longer be quiet. Now, she doesn't want all her information out there, but I have linked the video because she did release it to the public. Before we go deeper, I'd like to say that this episode is for entertainment and educational purposes only. Now, folks, this is happening everywhere. Hospitals, nursing homes, rehab centers, the exact scenario that I gave you. Families are being asked to sign papers they don't understand. And the truth about coverage is being buried under jargon and fine print. And worst of all, people like you and me are making these types of decisions, which could be a life or death decision based on this. Hospitals are supposed to tell you, nursing facilities are supposed to explain the difference between being admitted as an inpatient versus being under observation. Now, on paper, that difference is everything. It decides in most cases, no matter what insurance you have, whether your stay will be covered or whether families are left with crushing bills. But according to this nurse that I came across, a frontline worker who doesn't want to be named, that conversation is not happening in the way that it should. And guess what? She isn't alone. Since her post online, there have been more and more voices that have come forward. Patients, families, even other healthcare staff. Their stories are echoing one another. The same scenario again and again. A loved one rushed to ER, a form handed across the bed rail, signatures scribbled in fear, and then weeks later, the shock of a bill they never expected. Bills that could have likely been avoided if someone had simply taken the time to tell the truth. This is so problematic in itself, but combined with the fact that many, many, many people are living on a fixed income, this could be the difference between eating this week or next, perhaps keeping your electricity on, or even paying rent. And according to this nurse, a whistleblower, really, it's not an accident. The system counts on confusion. It counts on fear. It counts on the fact that in those moments of crisis, people will sign anything to keep their loved ones safe. And maybe for me, I would say that's the most chilling part because in the gray area, between what's supposed to happen and what actually does, ordinary families are paying the price. That's the weight of her words. And that's where this story begins with a whistleblower risking her own job to warn us about a system that was built to heal, but sometimes profits by helping people, well, really keeping people in the dark. So, who is this whistleblower? Specifically. And I told you she wanted to stay as anonymously as possible, though I'm not sure that's going to happen because she posted this video. She is a nurse and she does work in the ER. And one night, after another patient was rushed in, another family cornered with impossible paperwork, she couldn't stay silent any longer. She put her story out there online. She claims not for fame, not for recognition, but because she believes that families have a right to know what is really happening behind hospital doors. Now, I can't validate her credentials. She doesn't want to be identified. I don't know what hospital she works at. So when I was doing my research, I wanted to keep those things in mind. However, what struck me wasn't just her words, it was the chorus of voice that followed that I found in my research. And there were countless people in healthcare sharing the same story that the nurse described. And I want to tell you something of these stories, there's a specific demographic that they're focusing on, and that is elderly or vulnerable patients coming through the ER. They weren't always told the whole truth. Instead of clear explanations, they were handed a form. Instead of any honest guidance, they were told, sign here or risk thousands of dollars a day, not getting paid. And she claimed it was part of a hush hush push, a quiet shift in how hospitals handle older patients, one that leaves them with staggering bills despite having insurance. Now, her words to me appeared really urgent, and these are her words. These are her exact words. We're supposed to tell them, we're supposed to explain, but in practice, the system counts on confusion. It counts on fear. Now, I know what some of you might be thinking right now. She's anonymous. She hasn't shown her badge. How do we know she's even really a nurse? And the truth is we don't. Like I said earlier, we simply don't. She doesn't want to be identified, and I can't hand you her credentials. But here's where I would push back on the doubt. Even if you question her, which you should do your own research. Can you really question the hundreds of families echoing the same story? Grandmothers, veterans, sons and daughters, blindsided by bills, healthcare workers quietly nodding along, saying, yes, this is happening. And that's why I didn't stop at her post. I kept digging. I wanted to know, is this a one type rumor or is it a symptom of something bigger, something systemic? And what I found wasn't a smoking gun or a memo stamped confidential. What I found was actually a little bit more disturbing than that, a system built on technicalities, paperwork, and quiet vocabulary that decides who gets covered and who gets crushed. And it all comes down to two words: inpatient and observation. Now, those are words that sound harmless, almost interchangeable. But in the hospital world, those words can mean the difference between your insurance stepping in, for example, or families being left with thousands of dollars in unexpected charges. And here's the part no one explains in those frantic ER moments: the paper you sign can lock you into one or the other, and you won't realize until the bill shows up. And also, I think it's important for you to understand that it's not just about one type of insurance or about just one form or one loophole. It is about a system that has been quietly redesigned to keep patients, especially the elderly, off balance. Think about the moment. If you've ever been admitted to a hospital or had a loved one admitted to the hospital, think about that moment. You're scared, you're exhausted, they're exhausted. You just want them to be safe. They just want to feel safe. That's when the paperwork comes, a stack of forms full of language no ordinary person would ever use in real life unless, unless that's your job and your one and only job. But it's observation status, facility fees, self admin pay, non covered charges. Each term sounds technical to someone who doesn't understand, especially someone under duress already. It seems almost harmless, but behind every line is a door that opens or slams shut on whether your care will be paid for or whether you'll face a bill that could break you. Now, some of you might be thinking at this point, but yeah, there is a hospital representative there that helps us through the process. I remember that when my mom was got sick very young, so she was in and out of hospitals a lot, and there was always a hospital representative there. And yes, you might get lucky and not have this problem at all. But from what I gathered during the research process and from my own experience with my own mother, most of those people say that they are supposed to explain it and they're there to walk you through it. But the truth is, most of the time, they don't. And the system doesn't seem to want us to really understand it. It seems to benefit when people sign in fear and confusion. And you can find real families from all over sharing this story. Pressured signature, surprise charges, debts that made no sense. Some had Medicare, some had private insurance, some thought they were fully covered, but the outcome was the same. Bills they never saw coming, charges that they didn't agree to, consequences they didn't even know were possible. And this isn't about just one program, one insurance card, or one age group. I do want to be clear with that. It seems to be about a business model, a model that seems to thrive on technicalities, on fear, whether it's a $20 aspirin charge at hospital rates, a $3,500 a day clause buried in the fine print, or a rehab stay denied because of one unchecked box, one word that didn't fit the language. The effect is the same. The effect is the same. These are people being financially ambushed on when they're at their most vulnerable. This is the architecture of confusion, built piece by piece, policy by policy, form by form. And unless you know how to read the blueprint, you don't even realize that you've just walked into that trap that I mentioned at the beginning of this episode. I wish I could say that this was just about forms and policies, but that would not be true. It's about people, real people. A daughter whose father spent 3 nights in the hospital after a fall. She assumed, of course, that his insurance covered it. But because of one unchecked box on admission, he was billed as if those 3 nights were outpatient care. Want to know what the bill was? Nearly $18,000. Another story I ran across was a woman, a grandmother living on Social Security, and she was discharged to a rehab facility. She thought that would be covered, yet a month later, she was told the stay wasn't eligible for coverage. She obviously broke down in tears as she told her children she has no idea how she's going to pay for it. So there's that side of the coin too. And then there was the veteran. He believed his benefits would protect him. Instead, he got a letter saying he was personally responsible for thousands of dollars in non covered charges. He survived combat, but he couldn't survive the billing department. These are not isolated incidences. What I see are patterns, families drained of savings, seniors cutting pills in half because they can't afford their medications anymore, children taking out loans to pay hospital bills for parents who thought they were covered. And if that's not bad enough, there is another hard part of this lesson. It's the silence. Most people never even know they had the right to ask questions. Most never realize what they signed until it's too late. That silence, that gap between what families deserve to know and what they're actually told, is where the system profits. So, breaking that silence is one of the reasons I share the stories I share on this podcast. And if you're finding value in the stories I share, consider becoming a channel member here. Memberships give you extra perks like behind the scenes updates, member only posts, and a closer seat to this community we're building together. It's my way of giving something back to those who choose to support this work. And if memberships aren't your thing, you can still support the channel in many ways. Some of you listen to me on all the podcast platforms. Other watch the video podcasts here on YouTube, for example. Every play, every listen matters. Subscribing, sharing, liking, and commenting helps this channel in more ways than you realize. And if you'd like to take a step further, you can always support me through Buy Me a Coffee. The link is in the description. Think of it as leaving a tip at your favorite diner, a small way to say, keep going. What you're saying matters on this channel. Your support doesn't just fuel this channel, it fuels the mission of shining a light into places most people never look. Now, this episode, we are talking about confusion, insurance, the hush hush, the whistleblower, telling the story of what happens to millions and millions of people. And this is a cost of confusion, not just in dollars and cents, but dignity, stability, and trust. The very things we think healthcare should protect are being chipped away one bill at a time. And there is a truth here, a heartbreaking truth. This is hitting seniors harder than any other demographic. Older adults, already on fixed incomes, already vulnerable, are the ones being asked to carry the heaviest weight of this broken system. And, might I add, the whistleblower said the ones most targeted. And if you're new here, you should know I usually don't like to talk about policies like this unless I can offer some kind of solution or at the very least some help. So, this is no different. Let's do that now because while we can't fix the system overnight, there are ways to protect yourself and your loved ones from falling into the trap. The first step is simple but powerful. Always ask questions in those chaotic moments. Don't let fear silence you. Ask if you can, am I being admitted as an inpatient or kept under observation? Those words matter more than you think. So write them down, repeat them, make sure that your question is answered. Second, to the best of your ability, know your paperwork. I get it. It is a lot to know. There is a lot of jargon in there. Hospitals are required to give you notices, things like the Medicare outpatient observation notice, for example. You wouldn't want to just sign it. You would want to read or have someone you trust read it. If you don't understand, ask again. You have the right to clarity. Now, that is just an example that I use. There are all kinds of different forms depending on your insurance. The third thing is call your insurance provider immediately. Don't wait for the bill. Ask them directly, what does my coverage look like for this admission status? Sometimes you'll catch problems before they balloon. And if you have the opportunity, you can preempt that by going through and trying to figure out what things cover to the best of your ability. And fourth, don't do this alone. Bring a trusted family member, friend, anyone who can be your second set of eyes and ears. Hospitals move really fast sometimes, and sometimes they don't. Sometimes you could be sitting in ER forever, but they do move really fast sometimes, and fear can cloud your judgment, especially in a real emergency. So, having a trusted witness can slow things down, and sometimes that's enough to change the outcome. Now, I'm not pretending that these things will be a perfect shield. The system is complicated on purpose, but knowledge is power. Asking the right questions, refusing to sign blindly, and insisting on clarity can make the difference between protection and financial devastation. And remember, you are not powerless. The more you know, the less the system can thrive on your confusion. And the more people speak up, the harder it becomes to keep you in the dark. That's why I believe it was important to bring this nurse, this whistleblower, if you will, to you. And I believe that's why she risked speaking out. And that's why I'm sharing all of her words so you and your loved ones can walk into the hospital and you can be armed, not with fear, but with more awareness. So, yes, the system seems to be complicated on purpose so far from what I'm uncovering, excuse me. And yes, it can feel overwhelming, but the truth is When you know what to ask, when you slow down and demand clarity, you take back a little power. And sometimes that's enough to stop the worst outcomes. But none of this would even be on our radar if it weren't for the people who were courageous enough to come forward and to tell us their own experience. And even though we may not ever know the hospital that that particular nurse worked at, or the full story of her career, her decision to speak out lit a spark in others. And then the word started to spread, and more people are coming forward and say, yes, we've seen it too. And here's the part that stays with me. She didn't seem to come forward for attention. She came forward for you, for me, for anyone who has sat in a hospital room, scared and exhausted, pen in hand, not realizing that a single signature could change everything for you. So I think it's important for us to remember that we're not helpless. You're not helpless. You can ask questions, you can slow the process, and you can bring someone with you. And you can refuse to be rushed into signing something you don't understand. Because as I see it, that's what the system is counting on: confusion and fear. So here's what I want you to remember: you are not helpless. You can ask questions. You can slow down the process. You can bring someone with you, and you can refuse to be rushed into signing forms you don't understand, because it seems the system will be counting on confusion and fear. But when we share these types of stories, we're demanding answers. When we watch out for one another, confusion begins to lose its power. So, this is bigger than one nurse, bigger than one hospital. It's about every family who walks through those hospital doors to know, to not be confused. And if we keep talking, if we keep questioning and keep shining light into the dark corners of this system, maybe we can make a change. But until then, I'll keep digging, I'll keep listening, and I'll keep bringing these stories to you, not to scare you, not to incite people to be upset, but just to make sure that in the moments that matter most, you know what to do. If you're finding value in the stories I share, consider becoming a channel member here. Members give you extra perks like being behind the scenes, members only posts, and a closer look into the community that we're building together. It's my way of giving something back to those who choose to support this work. And if memberships aren't your thing, you can still support me in so many ways. Some of you listen to me, to this podcast on all the different platforms. Others watch here on YouTube. Every play, every listen matters. Subscribing, sharing, liking, and commenting helps keep this channel going in more ways than you realize. And if you'd like to go a step further, you can always support me through Buy Me a Coffee. Your support doesn't just fuel this channel, it fuels the mission of shining light into the places most people never look. And until next episode, take care of your mind, body, and soul.